Has ever heard of the Ayurvedic medicine, the traditional medicine from old India? So I just see, yay, that's very good. So we worked. I do Ayurveda since 35 years now in Germany. And as a medical doctor, it's always fun to treat with that. Because, you know, if you are a modern doctor, very often you have to tell your patients you can keep your disease. Let me just see, I'm not too long. So you have to keep your disease because we cannot help you. It's a chronic situation. And in Ayurveda we know that there's different stages how a disease develops. So we see in a very deep level, we can understand it, and many diseases come from what we call ama in Ayurveda. So you have residues in your body from going to bed too late, or eating too late, or eating the wrong things, or stress in your system. And when you do that, gradually your body gets toxins. And these toxins, when you don't get rid of it, gradually sum up over months and years. And then in the beginning time, maybe you don't have much symptoms. You just feel a little bit dull or a little bit tired, or your joints may hurt, something like this. And you wouldn't go to a doctor. But when you're an Ayurveda doctor, we have a very differentiated pulse diagnosis. So if you're interested, you can come to our stand. And with that pulse diagnosis, we can see diseases in a very, very early stage. So you can see something which is developing and treat it in a minute where the disease is just little. And when the disease has become really strong, of course, then you would need more therapies. So Ayurveda uses basically 20 different therapies, because Ayurveda, if you translate it, Ayus means life, and Veda means knowledge or complete knowledge. And there's a very deep knowledge how diseases develop. So, and what we do with Panchakarma is the age-old system where you can reduce toxins and the reasons why a disease has developed, where you can reduce that very gradually and systematically. So, for example, we have oil massages, we have enemas. It's a very deep system how you can gradually build up or redo the disease which has developed. And that means after a treatment like this, which may go from 10 days to 14 days or longer in severe cases, after that, patients always say, I feel so much lighter, even the mood is much better. And some Western doctors have started studying this, and also in India there's a big upsurge now of scientific studies to really prove that this is helpful. And the surprising thing was that the modern toxins, all the pesticides and herbicides, which we can really test inside the blood, when you do a treatment like this, that in 12 days, that was the study, in 12 days you can get rid of so many toxins, what your normal body under normal circumstances would need another 25 years for that. So it's a very, very deep cleansing and purification. And when the body is more pure, something happens which you don't need to control. It starts to repair itself. And we also saw that if you test the oils which we use for the oil massage, that it can bind heavy metals, all things where the modern medicine doesn't really have a help. So you can get rid of all the reasons, the deeper reasons why a disease has developed. And doing such a treatment, that's the nice thing about it, doing these treatments, it always wants to balance. So in Ayurveda, if we talk about the word disease or health, if you translate it, it's a Sanskrit word which is called svasthya. And svasthya doesn't mean you're healthy, it means you are balanced in yourself, balanced in your deep self. So also the psychological health is very important, and it goes together. It's never possible in Ayurveda to just treat somebody and the disease goes down. But what we do and what we aim at is that also the psychological well-being is there. So you feel much lighter in the end, and also at the same time there's more happiness, there's more strength, the exhaustion goes back, something like this. So it's a very deep treatment, and it comes from a very old system. I don't know if you know that the Ayurveda system is the eldest medical system which is there. And basically we wouldn't say it's a medical system because it's the knowledge about a life. So when you come to an Ayurvedic doctor, he will not tell you just take this herb or do this. He will also tell you what to eat, when to eat, to really prevent further disease and help you. And the good thing is you can really treat severe diseases with that, like asthma or rheumatoid arthritis or migraine. And when the patients come, they always think they have to keep that till the rest of your life. But basically it's possible to also bring that into balance. So we don't talk so much about disease. We talk in Ayurveda about balancing the person who comes with something. And the symptoms, they are just showing that something is wrong. But going to the balance somebody from the root, and also prevent that the disease will come back or the imbalance will come back. So if we talk about this, it's very important to say that people are completely different. So we basically treat less the disease, but the person. And we have a very systematic analysis of the so-called doshas. If you're interested, you can come to our stand. We have prepared a little questionnaire, so you can cross all your personal things which you like, which you dislike, how you react on weather, if you're sweating or not, all kinds of things which you can think of. And then to find out which kind of personality you have. And that is basically what we treat. So it's basically always about balance, about balance. So gradually you come down, and I think in this area here, just be interested. You can go to the internet and find out about many things about Ayurveda. It's a very sophisticated, very interesting medicine. And as the nice lady just said here, it is really starting to become more and more. And also in the West now, we have a combination with a university which starts to do studies now. And there are many people offering Ayurveda because the patients want it, because they feel there's a big success. And the help they get there is much deeper and more long-lasting as if they would just take pills. Okay, thank you very much for your attention. Okay.
Thank you very much, Dr. Pirc. Of course, it's very difficult to speak about such a serious subject in this kind of an environment, and therefore I really request all of you to please go and visit the Maharishi Ayurveda stall, which is right here. Ayurveda is something that we don't learn in India. It's a part of our lifestyle. It's a part of what we learn right from the child.